Alright, so today we're going to go over Chapter 7. This is going to be anatomy and physiology and a little bit of medical terminology. Alright. We're going to go over anatomical terms, body systems, medical terms. Alright, always start with a case study. EMTs Kevin and Tom have just arrived on scene of a patient with multiple stab wounds. Law enforcement has secured the scene. Following Kevin and Tom approach the patient, they find a man in his 20s. Kevin notices immediately that his patient appears to be unresponsive with pale skin. His shirt and his upper portion of his pants are saturated with blood, and the blood has started to pool on the floor around the patient. Tom reports that the patient has a weak carotid pulse and begins managing the patient's airway and ventilations. Cutting away the patient's clothing to determine where he has been stabbed, Kevin sees 2 stab wounds to the left side of the chest, and a stab wound to the right upper abdomen, and a stab wound to the right groin, and several cuts to the forearm and hands. So what organs may or may have been injured with this stabbing? Alright. Upper right abdomen, left side of the chest. What's on the left side of the chest? Okay, heart, lungs. Upper right abdomen, what's there? Okay. And a stab wound to the right groin. What do we need to be worried about with that? Arteries. Alright, what kind of terms is Kevin going to use to describe the exact locations of each wound? That's something we're going to go over, okay? Basic knowledge of the human body includes the study of anatomy and physiology. The word anatomy refers to the structure of the body and the relationship of its parts to each other. Alright, the word physiology refers to the function of the living body and its parts. So it's how it works. Knowledge of the human body and its systems is essential to high-quality patient assessment and emergency care. This knowledge will help you recognize when the body is working as it should and when life-threatening deviations to normal functions are present. Using proper terminology to describe the human body will also enable you to concisely and accurately communicate patient information to other healthcare providers. All right, what is the normal anatomic position? All right, when you're talking about a patient, this is what you're going to use, the anatomical position. All right. One term that is essential for you to understand and use is anatomical position. Unless otherwise indicated, all references to the human body assume the anatomical position. This patient is standing erect, facing forward, arms down at the side, with palms forward. This basic position is used as the point of reference whenever terms of direction and location are used. Alright, some of the positions of the body that we use are used to describe how the body or how a patient is found. Are they supine, prone? What does supine mean? On their back. Prone means? Alright, lateral, recumbent. Alright, Fowlers. Sitting up a little bit, yeah. Semi-Fowlers. Okay, it's a different angle. Trendelenburg, we don't really use that a whole lot anymore. And shock positions. You might know what shock position is. Alright. Alright, here's your supine position. Your prone position. Right lateral recumbent, left lateral, Fowlers, shock position. Alright. Imaginary divisions of the body are called anatomical planes. Anatomical lines are also used as reference points on the body. These planes and lines indicate the internal body structure and the relationship of different groups of organs to others. You have sagittal, mid-sagittal, a frontal, coronal, transverse, horizontal, midline, mid-axillary, and transverse. All right, the sagittal plane or the median is a vertical plane that runs lengthwise and divides the body into left and right segments. The segments do not have to be equal. The plane divides the body into two halves. It is referred to as the mid-sagittal. The front or coronal divides the body into front and back. Transverse or horizontal is parallel with the ground and divides the body into upper and lower. It may also be called the axial plane. Midline is an imaginary line drawn vertically through the middle of the patient's body, beginning at the top of the head and continuing down through the nose, the navel, and the ground. Midline corresponds with the mid-sagittal because it divides the body into equal halves. Mid-axillary is an imaginary line drawn vertically from the middle of the patient's armpit down to the ankle. This line also divides the body into the anterior, which is the front, and the posterior plane, which is the back. Transverse is an imaginary line drawn horizontally through the patient's waist. This divides the body into the superior and inferior. All right, anterior means what? Huh? The front. Posterior means what? Towards the back. Superior means what? Towards the head or above the point of reference. All right, inferior means towards the feet or below the point of reference. Dorsal, towards the back or the backbone or the spine. Ventral, towards the front of the belly. Medial, towards the midline of the center. Lateral refers to the left or right of the midline or away from the midline of the body. If I say bilateral, what does that mean? Both sides. Okay. Unilateral refers to what? One side. Ipsilateral. Same side. Okay. Contralateral. Opposite. All right. Proximal means near the point of reference. Distal is distant or far from the point of reference. Right and left is always the patient's right and left. Not your right or your left, but the patient's. Okay? Midclavicular refers to the center of each of the collarbones, which are your clavicles. The midclavicular line extends from the center of either collarbone down the anterior thorax. Mid-axillary refers to the center of the armpit or the axilla. The mid-axillary line extends from the middle of the armpit to the ankle. Plantar and palmar. Plantar refers to the sole of the feet, and palmar refers to the palm of the hands. Okay? Regions of the body. You have the head, or head, torso, or trunk, and then your lower extremities. All right? Most of us know these already. Terms used to describe the anterior chest. This is where your midclavicular, mid-axillary, mid-sternal line. Okay. All right, this is your posterior side. You have a mid-spinal and mid-scapular. Your lateral chest. You have anterior and posterior axillary lines. You kind of need to know these two, where all the major bones and organs are. You get plenty of work on this with the handouts that are mandatory. The handouts are mandatory. All right, you have a cranial cavity, spinal cavity, thoracic cavity. The diaphragm separates the thoracic cavity and the abdominal cavity. Then you have a pelvic cavity. Okay. The abdomen may be referred to as if it were divided by horizontal and vertical lines drawn through the umbilicus or the navel. You have four parts. All right, it's the right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. The musculoskeletal system of the human body consists of bony framework or skeleton held together by ligaments that connects bone to bone, layers of muscle, tendons that connect muscle to bones, and various other connective tissue. The system must be strong to provide support and protection, jointed to permit motion, and flexible to withstand stress. The skeletal system serves 4 functions, giving the body its shape, protecting vital internal organs. It allows for movement, and it stores minerals, and it also produces blood cells. I would suggest you know all 4 of those things. The skeletal system has 6 basic components: the skull, spinal column, thorax, pelvis, and the upper and lower extremities. The bones of the adult skeleton are classified by size and shape, which is long, short, flat, or irregular. All right, there should be a diagram of this in your book. The skull protects the brain. It consists of the cranium and the face. You have cranial bones: the occipital, parietal, frontal, and temporal. You have 14 facial bones. You can actually fracture these bones, okay? You have an inflexible cranium, which cannot accommodate swelling of the brain. The spinal column is divided into 33 stacked vertebral bones separated by intervertebral disc, okay? You have 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and 4 coccygeal. All right, the thorax. You have 12 pairs of ribs that attach posteriorly to the thoracic vertebrae. The first 7 pairs attach anteriorly to the sternum. The next 3 attach indirectly to the sternum, and the last 2 are not attached at all. Okay, they're what we call floating. The pelvis is in the shape of a ring. It consists of the sacrum, coccyx, ilium, ischium, and pubis. It supports and protects your internal organs like your bladder, intestines, fallopian tubes, ovaries, stuff like that, if you happen to have them. All right, the lower extremities. This is your hips to your toes. Femurs form a joint with the pelvis at the acetabulum. The knee joint is protected by the patella. The lower leg bones are the tibia and the fibula. Tarsals and metatarsals make up the foot and the toes. Upper extremities. This is your shoulder to your fingers. The humerus forms a joint with the clavicle and the scapula. The bones of the forearm are the radius and the ulna, and the carpals and metacarpals make up the hands and fingers. All right, joints. All right, this is points where one bone meets another. Can be movable, slightly movable, or immovable. There's different kinds. Your motions, you have flexation and extension, abduction and adduction, circumduction, pronation and supination. Flexation is bending towards the body or decreasing the angle between the bones or parts of the body. Extension, straightening away from the body or increasing the angle. Abduction, movement away from the midline. Adduction, movement towards the midline. Circumduction is a combination of all the motions, kind of like your shoulder. It can move 360 degrees. All right. Pronation, turning the forearm so the palms of the hand is turned towards the back. And supination is turning the forearm so the palms of the hand is turned towards the front. Your types of joints. You have ball and socket. This is the type of joint permits the widest range of motion. You get flexation, extension, abduction, adduction, and rotation. It's going to be your shoulders and your hips. Hinge joints. These are your elbow, knees, fingers. Permit flexation and extension. Pivot joints. This is a type of motion that allows for turning motion. It includes a joint between the head and the neck at the first and second cervical vertebra and those in the wrist. Gliding joints, the simplest movement between bones. One bone slides across the other bone to a point where surrounding structures resist the motion. These are where your the small bones in your hands and feet. Saddle joints. The joint is shaped to permit a combination of limited movement along perpendicular planes. The ankle allows the foot to turn inward slightly as it moves up and down. Condyloid joints. This is a modified ball and socket that permits limited motion in two directions. You have this in your wrist. You can move your wrist up and down, but you can't rotate it completely. Alright, here's pictures of all the joints. Fracture is the loss of continuity in the structure of a bone. When a fracture to a bone occurs, the sharp fragments may injure surrounding tissue such as nerves, vessels, and connective tissue. However, it is important to note that bones are also living tissue and have a rich blood supply. If the bone is fractured, the vessels within the bone may be torn or ruptured. This sometimes leads to severe bleeding from the bone itself rather than from the surrounding vessel or tissue. A patient can lose 1,000 to 2,000 milliliters of blood from a fractured femur. A bleeding pelvic fracture may cause the patient to lose their entire blood volume of 7 to 8 liters into the pelvic cavity. So, when you assess a patient who has suffered a bone fracture, look for signs and symptoms of bleeding at the fracture site. If the bleeding is severe, be aware that it may produce a shock state. Alright, your vessels come in and out of the bones, okay? So when that bone end, or when that bone breaks, it usually does not break smoothly. It's usually got little jagged edges, okay? And it can cut your vessels and stuff, nerves, all kinds of stuff. Movement of the body is due to work performed by the muscles. What enables muscle tissue to work is its ability to contract when stimulated by a nerve cell. The cells of a muscle are called fibers because they are usually long and thread-like. Each muscle has countless bundles of closely packed overlapping fibers bound together by connective tissue. 3 types of muscles. You have skeletal, smooth, and cardiac. I would know that. Alright? Go with this in your book. You're going to get plenty of opportunity to do this in your handouts. Under the control of the brain and the nervous system, skeletal muscle or voluntary muscle can be contracted and relaxed by will of the individual. This type of muscle makes possible all deliberate movements such as walking, chewing, swallowing, smiling, frowning, talking, or other movements. Alright, it forms the major muscle mass of the body, helps shape it, and helps form its walls. Smooth muscle or involuntary muscle is made up of large fibers that carry out the automatic muscular functions of the body through rhythmic, wave-like movements. For example, smooth muscle moves blood through the veins, bile from the gallbladder, and food through the digestive tract. That's not something we have to actually think about doing, is it? Your body just does it on its own. Alright, you have no direct control over it, though it responds to stimuli such as stretching, heat, and cold. Found only in the walls of the heart, cardiac muscle is a special kind of involuntary muscle, particularly suited for the work of the heart. It has the property of automaticity. What does that mean? Automaticity. Does it on its own, okay, automatically. That is, it can generate an impulse on its own, even when disconnected from the central nervous system. Alright, Tom continues managing the patient's airway and ventilation. Kevin has directed another EMT to apply direct pressure to the groin wound as he applies occlusive dressing to the chest wound. One of the chest wounds is 2 centimeters inferior to the left clavicle in the midclavicular line, and the other is 4 centimeters inferior to the nipple in the mid-axillary line. How can a stab wound to the chest impair ventilation and oxygenation? Huh? What about if he hit the heart?
Well, this means I don't bleed, for sure.
How could applying an occlusive dressing over the chest wound be benefit to the patient? Seals the wound, pressure. Okay. All right. So,
But
huh?
if they, I know it probably sounds stupid, but like if it's pierced the lung, wouldn't that create like an air pocket in his chest?
Yes.
If they closed it up?
If they closed it up,
Yeah, they put the dressing over the wound, wouldn't that create an air pocket?
that's what you want.
Um,
If you leave it uncovered, it's just going to keep sucking in air. We'll get to more of that later. All right, we're going to hit all the systems real quick, okay? The respiratory system. The body can store food for weeks and water for days, but it can only store enough oxygen to last a few minutes. Simple inhalation normally provides the body with the oxygen it needs. However, if the oxygen supply is cut off in a patient who is drowning or choking, brain cells will ordinarily begin to die in 5 minutes. All right. You have the oral cavity, nasal cavity, trachea. You have your bronchioles. Then you have your lungs. Okay. Air exchange actually happens at the cellular level in the alveoli. We're going to get into much, much more of that later on this week. Anatomically, the upper airway consists of the airway consists of the upper airway and the lower airway. Okay, you have upper airway, lower airway. The upper airway is structures from the larynx up. Below the larynx is considered the lower airway. The epiglottis protects the larynx and the lower airway from food and liquids. Okay, when you swallow something, liquid, food, that epiglottis flops down over your trachea and prevents it from going down in your lungs. All right, upper airway. You have a mouth, nose, pharynx, nasopharynx, oropharynx, and laryngeal pharynx. What do y'all think this does to aid the body? Huh?
Allows the food and air to come in.
Okay.
Without going down the wrong pipes.
Okay. What else does it do?
Allows air into the larynx, trachea, and lungs.
Okay. What? Cleans the air. Okay. Not only does it clean the air, it warms and humidifies the air as well. Okay. And it tries to get out any kind of big dust particles or something. That's why we have that sneezing reflex. Respiration is based on movement of gases from areas of high concentration to areas of low concentration. To be adequate, breathing must be adequate in both rate and the volume of air moved in each breath. Signs of inadequate breathing include an abnormal rate, irregular pattern, decreased or absent breath sounds, unequal or inadequate chest expansion, poor skin color, use of accessory muscles, nasal flaring, agonal respirations, and grunting. All right. So your lower airway, you have larynx, trachea, bronchi, bronchioles, and alveoli. The principal organs of respiration are the lungs, two large lobed organs that house thousands of tiny alveolar sacs responsible for the exchange of oxygen and carbon dioxide. We're going to go over this in much more detail when we get to the next chapter and chapter 10 and 16. The thin layer of connective tissue, called the visceral pleura, covers the outer surface of the lung. A layer of thicker, more elastic tissue, called the parietal pleura, covers the internal chest wall. Between the two layers is the pleural cavity. It's a tiny space with negative pressure that allows the lungs to stay filled with air. The diaphragm is a dome-shaped muscle that provides the majority of action that allows airflow into the lungs. It also separates the thoracic and the abdominal cavity. All right. You got your upper airway, nostrils, nasopharynx, oropharynx, laryngopharynx or hypopharynx, and your larynx. Your lower airway, trachea, bronchioles, and alveoli. All right, here's your linings of the lungs, okay? Which one covers the lungs?
Thoracic wall.
What?
Thoracic wall.
The visceral pleura, okay? Which one covers the intrathoracic cavity? The parietal, okay? All right, this is what a normal and a constricted bronchiole look like. So if somebody has asthma, this is the B. This is what their bronchioles look like, okay? They can't get air in, they can't get air out. All right, the difference in a kid and an adult, or a child and an adult. Child has a smaller nose and mouth. More space is taken up by the tongue. The trachea is narrower. Cricoid cartilage is less rigid and less developed, and their structures in their airway are more easily obstructed. I would know that. During inhalation, the diaphragm and the intercostal muscles, the muscles between the ribs, contract, increasing the size of the thoracic cavity. The diaphragm moves slightly downward, layering the lower portion of the rib cage, which moves upward and outward. This creates negative pressure in the chest, which causes air to flow into the lungs. During airflow into the lungs, during exhalation, the diaphragm and the intercostal muscles relax, decreasing the size of the thoracic cavity. And this is what allows the air to move out of the lungs, okay? The diaphragm receives its stimulation to contract from the phrenic nerve that exists in the spinal cord at the cervical spine between vertebrae C3 and C5. If a spinal cord injury occurs at C3, C4, or C5, the phrenic nerve may be damaged and the diaphragm will not receive an impulse to contract, okay? The intercostal muscles will also not work properly because the nerve that stimulates these muscles exits from the lower thoracic vertebrae. With an injury to the spinal cord high in the cervical vertebrae, the patient would not be able to breathe spontaneously and would require artificial ventilation. The diaphragm contributes to about 60 to 70% of the effort to breathe, whereas the intercostal muscles contribute the remaining 30 to 40%. A significant injury that prevents,